Bonjour. Buenos tardes.
Oh, my.
Good afternoon. Greetings, ladies and gentlemen, distinguished guests, colleagues, friends, and family. It is a privilege and honor to address you today on this momentous occasion. I take this opportunity to express my sincere thanks and appreciation for the confidence RNAO members have displayed in electing me as your president. I thank Carol Timmins, our immediate past president, Dr. Vanessa Borowski, our former past president, for their support. Dr. Doris Greenspan, our CEO, Home Office staff, members of the board, and the members of RNAO for your support over the past year. And lastly, I am thankful for the strength and wisdom I draw from my faith in Almighty God. My motto is support, serve, and advocate. As I begin my presidency, I would like to share my journey. I entitle it From the Bedside to the Boardroom, and the boardroom is the decision-making table. My journey commenced many years ago in clinical practice, and it was augmented with management, educator, researcher, collaborator, board members position. In all these positions, and in particular in clinical practice, leadership was paramount to advance patients' outcomes. I have worked in all sectors of the healthcare in all roles, including public health and primary care. The breadth and depth of these experiences and life itself have prepared me to be your president. I offer myself with unwavering commitment, with passion throughout this experience, with the support of the CEO, the board, and you, the member. We will continue our journey, moving from strength to even greater strength. Because we know with RNAO, the sky is the limit. The strength we have in RNAO allows us to tackle most difficult challenges. For me, one we must tackle is cultural competence. It is one of the things I see in our workplaces, in our study places. It has been for me a constant theme I have both experienced and tackled and work in all various sectors and roles. Cultural competence is a critical area for nursing interventions, and one I would like to further advance during my presidency. My expertise of research in cultural competence is vast and will serve us well. Together, we would practice and role model cultural competence amongst ourselves and with the patients and clients we serve. For example, my study on the influence of nurse characteristics on the acquisition of cultural competence can serve us in designing and teaching programs on cultural competence. Evaluation of cultural competence programs and courses, these are two other research studies, tell us that they were significantly effective in enhancing participants' level of cultural competence and the ability to transfer that cultural competence into practice. Similarly, research findings of the impact of cultural competence on clinical practice are informative to clinicians, administrators, educators, and policymakers. A few studies include perception of a culturally tailored adapted program to prevent type 2 diabetes, and exploring health beliefs and practices of Caribbean immigrants to prevent type 2 diabetes. These are just a few examples of my commitment to advance cultural competence, a commitment I offer to you and to RNAO. As an educator, I have taught undergraduate nursing students at the University of Manitoba and at the University of Ontario Institute of Technology. I have also taught graduate students at the University of Toronto and the University of Ontario Institute of Technology, and have been a member of the supervisory team for PhD and Master of Science students. For example, on May the 2nd, one of my students will be defending her thesis on palliative care, the lived experience of palliative care providers. And it's very powerful, and it fits in with one of the resolutions presented here today. As a collaborator, I have collaborated with the transdisciplinary teams in hospital settings, public health settings, Safe Kids Canada, OPHA, RNAO, and other organizations and coalitions to advance the healthy public policy. The following examples are just a few I have advocated for. They include amending the Highway Traffic Act, distracted driving, and passenger safety at the provincial level. Bill 118 and 126 were passed in September 2009. Another example is amending the Highway Traffic Act. One seat belt for one person. Limit the number of seat belts to the number of passengers in a vehicle, which became law in 2006. And this bill, this amendment, was augmented by a collision that occurred with a group of Chinese visitors to Canada, where they did not have enough seat belts in the vehicle that they were being driven in, and several of them died. It was the instigation for me to seek help from all my colleagues, as I mentioned before, and to lobby the provincial government to amend this Highway Traffic Act. As board member and director, I have served RNs, NPs, and nursing students on the board from 1996 to 1998, and from 2014 to the present time. These close experience as board member in the 90s and now allow me to work firsthand, firsthand the unimaginable growth we have experienced in all domains of the association's work. RNAO is a winning team, and you and our members are our biggest champions. During my term as president-elect, I advocated for you during Nursing Week celebrations, Queen's Park on the Road, Queen's Park Day, on issues such as social determinants of health, including homelessness, poverty, increasing the minimum wage, stopping RN replacement, utilizing RNs and NPs to the full scope of practice, transforming the healthcare system, and more. I have visited our MPPs in their constituency offices to talk to them about these different issues. Today, our CEO presented many of our collective wins in her morning report, and we thank you all for them. It is your active engagement that allows us to achieve what at times seems impossible. Witnessing our RNAO events this past year has been inspiring, and Carol has already mentioned those in her speech. The respect that I have seen for our work is second to none. Whether this is at the event during Nursing Week, the RN food dinner, meeting with the minister, or attending ONA biannual conference and dinner, RNAO has earned incredible respect and admiration. I've heard this from the Minister of Labor, Minister Flynn, during his reception for the hiring of a newly safety protection officer, and from the Minister of Correctional Services on the passing of Bill 6 at the second reading, and I encourage her to let that bill go to third reading before the elections in June. As I said at the onset, I am a collaborator. That collaboration began a long time ago and has expanded as I have met many of you during Nursing Week events, NRIG annual meeting, our general annual meetings, symposiums with different interest groups, RNAO, Region 10, Region 8, and during our assembly and board meetings. No doubt, I will meet many more of you as members now and as I enter 2 years of the presidency, and I look forward to it. As busy as I am now, and for sure will be even busier, I must admit that I live life to the fullest with God's help. I enjoy having work-life balance and take every opportunity to travel to different countries. During my presidency, I would like to power you up in 2 specific ways: advocacy and cultural competence. Ontario is culturally and ethnically diverse and has become even more diverse in 2018. Diversity is our strength. And based on clinical observations, we can do a better job in delivering culturally competent care to all our patients and clients in Ontario. As mentioned earlier, cultural competence is a primary focus for us to work on together. Cultural competence is described as a process in which the healthcare provider continuously strives to achieve the ability to effectively work within the cultural context of the client or individual, family, or community. And this is a definition from Kapfina Bakoti, 1999. Cultural competence has 5 interdependent components: awareness, cultural knowledge, cultural skill, cultural encounter, and cultural desire. A person who integrates all 5 components has achieved cultural competence. When the RNs, NPs, and nursing students cares matches the client's perception of their problems, incorporate the client's beliefs and practices in the plan of care, and meet their expectations for treatments, those nurses are providing culturally competent care. RNs, NPs, and nursing students have the power to change lives. If you are conducting clinical research on patients or families, I would encourage you to include culture as a variable in your studies. You may choose to add culture in the demographic data sheet so you could describe the characteristic of your participant. You may choose to add it in an open-ended question so you get some qualitative data. Or you may also choose to study the culture of another group to improve health care for that group. Additionally, if your institution lacks cultural competence policies, you may facilitate the development and implementation of them. I believe, and I strongly believe, that every patient or client should have a cultural competent assessment on admission to a hospital or clinical setting, because culture is powerful. It influences behavior and determines decision-making. Building on our AGM theme, Powering Nursing to Advance Health, I would like to power RNs, NPs, and nursing students to advance healthcare for all people in Ontario by leading and engaging RNs, NPs, and nursing students to stimulate membership, promote the value of our professional organization, RNAO. We can achieve this together by encouraging our colleagues, peers, nursing faculty, nursing students, staff nurses, administrators, and executive, as well as former members to join RNAO. Nursing professors and teachers should also encourage their graduate students to keep their RNAO membership and stay engaged with the association. RNAO benefits are numerous and cannot be paralleled with any other organization. Just think about the camaraderie, the lifelong friendships, the knowledge gained through seminars, webinars, BCGs, and the opportunities to influence policy and practice, as well as our legal assistance program and our professional liability. And every time I think of our legal assistance program, I remember a nurse called, who in the 80s when I was doing my master's, Susan Nellis, who went to trial. She didn't go to trial. She was accused of killing all those babies and sick kids. It never went to trial. But the funds needed to pay legal bills were huge. And through that incident, RNAO established the LAP program, and many of you have benefited from the legal assistance program. So what RNAO offers you? So I am pleading with you today to join me for us moving from 41,130 members. Let us end my presidency at 45,000 members. We can do it. By applying your knowledge, skills gained from RNAO's political action toolkit, policy backgrounders and submissions, evidence-based webinars, best practice guidelines, and RNAO platform document on improving health for all, we can advocate for changes in Ontario and can move mountains. We must continue to build the momentum underway in advocacy and policy engagement. Now, with the election fever, is more than ever, it's an opportune time to engage all politicians, to advocate for RN replacement, healthcare systems transformation, social determinants of health, affordable housing, increase in income, and the changes in the environment. Methods to achieve these goals, they're very important, so we could continue to work and to reach our goal. We know that on June the 7th, Ontario will elect a new government, whether the same party or a different one. I say to you, advocate, advocate, advocate now, because it is a great opportunity to reach all our politicians with our platform document. Are you ready? Are you with me? Yes. Together, we will advance the role and image of nurses as members of vital, knowledge-driven, caring profession and significant contributions to healthcare. Together, we will build a stronger, even RNAO and a stronger Ontario. Together, we will resolve problems and issues. Together, we will make the difference in the healthcare system and society. Remember, we know we can do it because we know that our collective voice has already made a difference in this province, nationally and internationally. I believe that adversity and challenges are pathways to success. They define who we are, and we are a force to be reckoned with. We would find creative ways to solve problems. Let us move forward with the same determination, passion, hope, and a united voice as we have done to date, because it has brought us unimaginable success. And yes, let us show everyone what a committed, diverse group of health professionals can achieve as we continue to unite more and more in diversity and inclusivity. Let us continue to be strong, determined, courageous, moving forward from one level of strength to the next, a force to be reckoned with. Thank you. Merci. Gracias. Yeah, I know. I thought
Beautiful. You did.